Well, to quote from Cool Hand Luke, what we have here is a failure to communicate.
The communication between the Met services and the public health officials, especially people at the high level.
The communication. It's important for the people for the climate to try to translate what is meaningful for the health community, and also for the health community to try to understand its language.
I would say it's probably the language. Climatologists speak one language, health community speaks another language.
We don't speak the same language yet, just yet. But I think that this kind of event is really important because we are going to learn how to do that, how to build a bridge.
A lack of a common language and misalignment of institutional incentives.
The fact that sectors traditionally do not talk very much to each other, so there's a need for really establishing good relationships, good collaboration across sectors.
I think it's essential to create a cadre of practitioners and researchers who think about health in its multiple dimensions of climate and land use and behavior and all of the factors that affect health.
I think it's trying to ensure that we have teams that are truly multidisciplinary because the problems with which we're faced are so complex.
For me, the main issue between climate and health should be the issue of data.
Get good data for both health and climate so that the interpretations of research would be meaningful.
Access to data, environmental data, health data, entomological data.
Data access and community capacity building from the bottom to the top.
The challenges on the ground are very different in terms of the day-to-day operations, and it's very important that we address how the data, good quality data, is accessible.
Yeah, lack of evidence, especially in developing countries like Bhutan.
The lack of knowledge in the basic mechanisms of certain diseases and the uncertainty surrounding that.
So it is very important for the community, especially at local level. We have to know climate at very local level. Yeah.
What I see that the most affected group are the communities, and we needed to make sure that we translated the information from the science to these people so that they can utilize.
I think that there should be more focus on actually the problem and finding what are the more appropriate tools to address these problems. And so I think that the training should shift towards teaching problems rather than techniques.
Identifying the users at the different steps within climate services and linking climate information to action.
Bringing the resources that are needed to the practical level in the case of the disease that I work on, malaria.
I would say the impact on the food supply and how it affects both undernutrition and overnutrition across the globe.
For me, definitely excessive heat is one of the major problems we need to tackle.
I think it's a possibility we may miss the chance to fix air pollution at the same time as we fix climate change.
Climate change is causing people to move out of the areas where they live, leading to the emergence of new infectious diseases. These are what we call climate change refugees.
How to address the risk of climate change to the 2 to 3 billion people who live in rural areas in the world, including the area where I work, which is the greater Mekong subregion, who are already vulnerable due to other environmental impacts.
A defining characteristic of the public health field is its high ethical standards, and it's a standard they've maintained for thousands of years. And as we seek to innovate with that field, we have to make sure we're meeting that high ethical standard, and that's largely about making sure that we're going to improve people's lives as we introduce new information.
There are many pressing issues, but the one that I think I would highlight is an optimistic one, which is that by solving the climate crisis, we can also have tremendous benefits for human health.